And now I would like to welcome our next speaker, Camila Ventura, co-chair of the Young Ophthalmology section of the Pan American Association of Ophthalmology, who will discuss COVID and its influence on ophthalmology training. Many thanks.
Hi, I'm Camila Ventura, co-chair of the Young Ophthalmologist Committee of the Pan American Association of Ophthalmology. And before I begin, I want to thank the SOE-YO in the name of my dear friend, Dr. Miguel Andrades, for the kind invitation. I want to say that I'm really excited to give this talk on this very current and relevant topic, that is the influence of COVID-19 on ophthalmology training. For background purposes, as we all know, the numbers of the COVID-19 pandemic are dramatic. It is quite shocking to see how it affected the entire globe and the negative impact that it had on humankind. As we can see here, there has been approximately 5.9 million deaths around the globe. And to give you an idea, this number accounts for the entire population of Singapore. Having said that, we would expect no less that COVID-19 caused a huge burden on the entire healthcare system, including the healthcare providers around the globe, for being in the front line of this battle. So the first question I want to answer is, how did the pandemic affect ophthalmology care, how we ophthalmologists were providing care to our patients and coping with the challenges? In ophthalmology care, and here I know that there's no surprise to any of you, the numbers of the elective procedures, both clinical and surgical, reduced drastically. This global survey by Sanjay and colleagues show that almost 50% of ophthalmologists stopped operating during the pandemic, and that 40% were operating less than 1/4 of their original volume. So, as a consequence and as a solution to maintain care provision during the pandemic, there was a shift towards telemedicine and home monitoring. This shift was reported in one of our COVID studies, where we addressed retina specialists in the world and found out that retinal diseases were being monitored by patients at home and also by their physicians using teleophthalmology. So now the big question here, the one that you're all looking forward to, is how did it affect the training of residents and fellows? Well, COVID-19 affected all spheres of ophthalmology training, starting by the residency matching process, because residency applicants faced a complex selection process during the pandemic. One positive aspect was the reduction of the financial burden, since all interviews were performed virtually. And another positive aspect was that the number of research publications were not reduced during the pandemic. So medical students, they were able to keep up with research. However, the downsides of the pandemic was the reduction of the practical training in medical school. Nearly half of the applicants reported that their rotation were canceled, and almost 80% did not complete externships. As for the residency training itself, we identify similar experiences being described by different countries. As we can see in this first Portuguese study, the training time spent in different specialties and surgical activities reduced among residents, and 1/4 of them were deployed to COVID units to help in the front line. This other study, this Polish study, describes the perspective of residents and fellows. They felt that the pandemic had a negative impact on their surgical as well as their overall training in ophthalmology. This study also mentions about the drastic change towards the virtual lectures and theoretical lessons during this period. This other study by our group corroborates with these two previous studies. We applied a survey to residents and fellows from all 7 continents and noticed the same change towards e-learning. As you can see here, 1/4 of residents and fellows stopped having in-person training during this period, and 63% of them stopped operating. In addition, there was a striking change of the training quality level reported by residents and fellows. As we can see here, we see a trend towards poor and very poor quality during the pandemic. So with all these changes and all the burden that came along with the pandemic, I bring up my last question to you all. What were the consequences on the mental health of residents and fellows during the pandemic? So as you can see here in this review study, we observe a rise in the incidence of depressive symptoms as well as anxiety and negative thoughts among young ophthalmologists during the pandemic. This study, performed in India with over 2,000 young ophthalmologists, showed that 1/3 of residents and fellows experienced some degree of depression, and that 1/3 of them had a hard time meeting their life expenses during this time. This study also highlights that depression was significantly higher in those at younger age, those that were not practicing and that were worried about their training growth, and those that were facing a financial struggle during this time. So now, based on all this data that we talked about and that now we are all aware of, it is time to find the means to overcome these challenges and achieve success by training resilient and capable young ophthalmologists with both clinical and surgical skills around the globe. To obtain that, the way to surpass all of this is by intensifying training from now on, since now we're back on track. We believe that to maintain the quality of training, services of ophthalmology must intensify surgical training, introduce virtual simulators, and maintain both in-person and the virtual forms of teaching, because one of the silver linings of COVID-19 is that it showed us that technology and the virtual forms of teaching has helped us shorten distances and has facilitated the exchange of knowledge. To conclude, I know that COVID-19 pandemic has been challenging to the young ophthalmologists in so many aspects that we cannot fully understand and grasp the different side effects that will unwind from it. However, a little word of wisdom here: challenges are what make life interesting, and overcoming them is what makes it meaningful. I want to end this presentation by thanking again the organizing committee for the opportunity to represent the PAO-YO in the SOE-YO webinar. Thank you very much.
Thank you very much, Camila. It was an excellent presentation. This COVID pandemic influenced our lives and also our training.